Hello again. I'm now spending the next 10 minutes discussing with you about urea. What is exactly? It's a polar hygroscopic molecule produced by the human body that plays an important role in the metabolism and excretion of proteins. It derives from degradation of filaggrin, which is a protein produced by keratinocytes with the function of binding keratin fibers and enhancing barrier function of the skin. Don't forget that approximately 7% of the components of the natural moisturizing factor, the stratum corneum, is made of urea, which, by the way, play a major role in the maintenance of skin hydration. The use of urea compounds date back to more than a century. There's a paper in the Lancet dated 1915, in which it was, for the first time, was claimed that urea was effective for dry and scaly skin. Urea can be used at different concentration, exerting different action. If we use a low concentration, or if we use a high concentration, which is more than 10%. When used so at different concentration, especially in a low concentration, urea exert a moisturizing action. Why? Urea acts as an humectant, attracts and retains water in the stratum corneum. It's also able to attract water from two sources, the dermis and, in humid condition, the external environment. When used at high concentration, more than 10%, urea exerts a keratolytic action. Urea induces protein conformational changes by breaking hydrogen bonds, reducing cohesion of keratinocytes. So they act low concentration and high concentration. They have two different mechanisms of action. Several studies from the clinical point of view investigate the effect of urea in different skin conditions characterized by dry skin or xerosis. Here is a list of disorders that I'm sure you all know, and you are all aware that urea can definitely improve some of these or the majority of these disorders. In addition, don't forget the urea is a worldwide available in different formulation and concentration, providing physicians several alternatives to improve the management of skin condition. So this is a concentration ranging from 2% to 50%. And the formulation, as you can see, range from lotion, emulsion, solution, cream, gel, foam, ointment, and nail lacquer, according to the countries in which the urea is distributed. Let's take a look to the clinical indication of urea-based topical products. Low concentration, medium concentration, high concentration. Don't forget that the more we go with the concentration, the more chance we have of potential skin irritation consisting of temporary redness, stinging, and burning. Take a look to what the literature says about urea at low concentration for xerosis. Several randomized controlled trials supported the efficacy of urea in the management of simple xerosis and in xerosis related to disorder with stratum corneum inability to maintain hydration, such as ichthyosis, atopic dermatitis, and psoriasis. Normally, the studies are designed as a clinical study with clinical assessment, but the majority also, they include instrumental evaluation of transdermal water loss and stratum corneum hydration. Regarding ichthyosis and the use of urea at low concentration, there are 11 trials which confirm that urea is effective and well tolerated. This is also a study we did in my department, in which we evaluate the efficacy of a 10% urea emulsion in 5 patients with ichthyosis vulgaris with clinical instrumental evaluation. Clinically, all patients showed an excellent response, significant clinical improvement of cirrhosis in each. This is before management, the 5 patients, and at the end of management. And also we did, this is a clinical evaluation at T0, at baseline, and at T1. You see that is a normal, returned to normal appearing skin. And also we did dermoscopy confocal evaluation, in which we can see the disappearance of scale with dermoscopy and then normalization of fluorocytes and morphology with confocal microscopy. Moving on, atopic dermatitis, we have also 11 trials. We include also the use of the corticosteroids and confirming that urea was effective and well tolerated. Again, don't forget that moisturizing is among the basic therapy that should be performed in all patients, irrespective of the management they're doing. So basic therapy should be done in all patients with moisturizer, in all atopic dermatitis patients. And among different type of moisturizer, this expert says that the clinical effectiveness appear most well documented for urea-based preparation. We did a meta-analysis on the topical moisturizer for atopic dermatitis, according, of course, to evidence-based medicine. We identify 11 moisturizers containing urea, and those have shown the greater evidence of efficacy. This is an example, keratosis pilaris of the arm in patient with atopic dermatitis, a baseline, A and B, and after 4 weeks of treatment with urea lotion showing excellent response. Moving on again, cirrhosis of the feet. Diabetic patients have a high incidence of feet cirrhosis with an increasing risk of ulceration. Study shows that urea is safe and effective. And moving on to medium concentration, 15 to 30%, main indication is hyperkeratosis. And useful in case of low to moderate hyperkeratosis involve large areas. In this case, when we use 30% for large area, we always have to think of the benefit, but also of the possible skin irritation. Some example, 30% urea cream for 2 weeks, this psoriasis of the earlobe before and after management. Again, psoriasis of the belly for 2 weeks, again, improvement, significant clinical improvement. Moving to the high concentration, 40 to 50%, moderate to severe hyperkeratosis is one indication, as well as chemical nail plate avulsion. High concentration useful in case of severe hyperkeratosis involving small areas, limited areas like these cases. An example, this was a resistant plaques of psoriasis, 50% urea for 2 weeks. All the scales are gone, the hyperkeratosis is gone, and now the patient is ready for a more effective topical treatment. This is a study, 25 patients with plaque psoriasis with an evident hyperkeratotic component, 50% urea anhydrous paste twice daily for up to 3 weeks, clinical assessment, and high frequency ultrasound assessment. This was a study we did in my department again. And the results are the clinical clearance of hyperkeratosis in 92% of cases and no side effect reported, with all patients showing that the product is excellent in terms of cosmetic acceptability. This is before, at baseline, 50% before management, with urea 50% anhydrous paste after 2 weeks, again, before and after. So the patient are now ready to a drug approach. Again here, all the thick white scales hyperkeratosis is gone, and the lesion now is flat. Ultrasound showed a significant reduction of the mean epidermal thickness, approximately 50% reduction, reaching a thickness similar to normal epidermis. Finally, another interesting use of urea at high concentration is for chemical nail plate avulsion in case of nail dystrophy, onychomycosis, psoriasis. This is an example of pachyonychia. After 2 cycles of 2 days application of 40% urea cream under occlusion, pachyonychia, onychogryphosis, baseline after 4 days of 40% urea cream under occlusion. Don't forget the urea also may act as a penetration enhancer by softening the nail bed. Urea allows a greater penetration of topical antifungals, corticosteroid and other drugs, improvement management outcomes. In onychomycosis, especially combination of 20–40% urea with antifungal agents has been shown to be superior to monotherapy. This is one of my last slides. So low concentration of urea, ideal for xerosis, ichthyosis, atopic dermatitis, psoriasis, xerosis of the elderly. Medium concentration of 50–30%, mild to moderate diffuse xerosis, hyperkeratosis, psoriasis, chronic eczema, hyperkeratosis localized in sensitive areas, face, genital area. It's up to physician experience to range between 15 and 30. Of course, high concentration, moderate to severe localized hyperkeratosis, for example, psoriasis, calluses, warts, keratoderma, or nail plate avulsion. My conclusion that urea is still one of the most useful products prescribed by dermatologists. Different formulation and concentration are available, providing valid alternatives for the management of skin condition with varying severity of skin cirrhosis and hyperkeratosis. You know, the concentration range from 2% to 50%. Urea products have generally few adverse effects, and there are no reports of sensitization despite its widespread use. Thank you again for your attention.